Hello, ladies and gentlemen, and thank you so much for having you today in a new episode of Brain Talk. And this time we'll talk about short lecture or short case report about ipsilateral weakness caused by ipsilateral stroke. And this is a unique symptoms that some patient brings to you. So we'll start with this case discussion here. A 67-year-old man, admitted to our hospital with left limb weakness with speech impairment for 5 days. A previous history of hypertension and diabetes mellitus type 2. This patient, had done an MRI that shows us a left side, a corpus callosum ischemia here. And this actually doesn't, explain how this patient have the left side weakness in the same side of the ipsilateral stroke. So actually, this is an drawing for the corticospinal tract, starting from the motor area here and going down to the forebrain and middle brain, starting to, and extend to the pons. After that, in the midline, starting to uniform a pyramid. This pyramid. After that, decussation in this area to other sides. So this is the usual corticospinal tract or the way where the tracks goes. But this patient, has the same side of weakness in the same side of stroke. So what's the cause of these strange symptoms and strange also this image for this patient? So actually there are four reasons for the same side weakness with the same side stroke. The first one is actually congenital and crossed pyramidal tracts. This is a tractography in the MRI, which shows the fibers or the corticospinal tract doesn't decussate or doesn't cross over to other side. This is the first reason, and this is the most explained reason for this patient. Second thing is called a reorganization of the neurons. Actually, some patients have previous stroke in one side, so that's make nerve function of other side to reconstructed to control the ipsilateral limb. We have here one example for this patient who started to have or had before a hemorrhage in the previous hemorrhage in the right bottom, and that after 3 years he has a left side weakness. MRI shows an left side bottom ischemia. That means all of our function of the left side, right side had been moved to the other side or the left side, and this makes the neurons in here in the left side, control the ipsilateral limbs, and this explains why this patient have the ipsilateral weakness in the same side of the stroke. Number three, the reason for these unusual symptoms is called the second motor area in the insula. We know that the insula is a second motor area and second sensory area that can control bilateral, facial, and lip movements. As we see here in this picture, this is the insula. This is second motor area. This has connection with the premotor area, and in the same time as studies before explained that this insula has can control the ipsilateral side of the limbs and the face. Lastly, or number four, the reason is called Opalski syndrome. Is a kind of lateral medullary syndrome, and it's breeding of a noun syndrome is called Wallenberg syndrome. It's the same as Wallenberg, symptoms, but the most, important thing, it's called ipsilateral weakness in the same side of the stroke. And actually, when we do MRI for patients, we see a lesion, is actually caudal to the corticospinal tract after, their decussations. And this is what explains the ipsilateral weakness in the same side of the stroke. As you see here in this picture, here is the medulla here, and this is, a stroke here. This is a stroke, and this is the tracts or corticospinal tracts. This is, where they, decussation, and the lesion actually is behind the decussation, and that's caused the ipsilateral weakness in the same side of the stroke. By these, explanations, we have now, that's now, studies the four reasons for the ipsilateral weakness in the same side of the stroke. Thank you so much, and having a good day.